So Representative Costa, you're recognized for 5 minutes.
Well, thank you very much, Mr. Chairman, Guthrie, and Ranking Member Fletcher for your comments. And to follow on that opening, 3 pieces of legislation I will speak to you on are bipartisan pieces of legislation. And I think they deal with America's safety net and affordability because every American feels near and dear to ensure that they have adequate and cost-effective health care that's accessible to them and their families. I mean, as my mother used to say, Jim, if you don't have health, you don't have anything. The first piece of legislation is a touching one for me and my staff, H.R. 5355, Ian Calvincuss legislation. It deals with Pediatric Liver Cancer and Early Detection and Screening Act, and expanding the Medical Education Act is the second piece of legislation, and the third piece of legislation is the National Plan for Epilepsy. This follows in the effort of preventive health care. For Ian's piece of legislation, it's personal. He came into our office as an intern from UCLA with all sorts of aspirations and optimism. But as an earlier child, he was diagnosed with liver cancer as a young teenager. He survived thanks to a life-saving liver transplant. Unfortunately, the cancer returned a few years later, but Ian cared deeply about giving back, and while he was sick, he took an opportunity to be an intern in our office here at Capitol Hill. He said, I want to make a difference now, and he used his time here to advocate for early diagnosis and treatment for children with liver diseases. Sadly, Ian passed away during his time as an intern in my office this last summer at the tender age of 20 years. This bipartisan bill, which I lead with Congresswoman Van Dyne, honors his courage and advances the reforms he fought for. It would direct Health and Resources and Services Administration, HRSA, with input from Centers for Disease Control and Prevention, CDC, to lead a national public education effort to recognize early warning signs and understand the options like living liver donations, which are critical. It also would require Government Accountability Office to review the pediatric liver wait list outcomes and value the adding of liver screening to state of newborn screening panels. This would use existing resources at the Department of Health and Human Services. That is the first piece of legislation named appropriately after this young intern who had so much inspiration and hope. The second piece of legislation, H.R. 2106, expands the Medical Education Act. The Medical Education Act responds to physician shortages that we have throughout our country in underserved areas. All the members, I suspect, of this committee have challenges in their own constituencies with a shortage of physicians, especially in our rural and underserved areas. The San Joaquin Valley, one of those areas, has the lowest supply of doctors in California, where we have 47 doctors per 100,000 residents. That's way below the national average. This bill would provide grants through Health Resources and Services Administration, HRSA, to help establish and expand medical schools in underserved communities and areas where there is no medical school, and a minority-serving institution so we can train more doctors where we need them and where they're more likely to stay. We are in that process of establishing a new medical school in the San Joaquin Valley for that very reason. HR, the last measure, HR 1189, the National Plan for Epilepsy Act, is another bipartisan piece of legislation, a plan for epilepsy, which I lead with Congress member Greg Murphy, who he and his family have had their own experiences with epilepsy, as many of us know family and friends. This responds to a condition that affects 3.4 million Americans. For too many patients, current treatments do not work and the federal response is fragmented. This would attempt to correct that. The bill would direct the Secretary of Health and Human Services to create and maintain a coordinated national plan for epilepsy, guided by a National Epilepsy Advisory Council that brings together federal agencies, clinicians, researchers, advocates, and people living with epilepsy to set goals, track progress, and get the most out of every federal dollar, which I think we all share in common, for preventive health care maintenance, which is really what these 3 pieces of legislation are all about. Let me close by saying the 3 efforts have a common purpose: to give every family a fair shot, whether that's living with cancer, detection, being able to see a doctor close to home, are living with epilepsy in hopes of having better care. Mr. Chairman, I also submitted separate written testimony to support H.R. 1395, the CURD Act, with the attached IDFA letter of support. I'd respectfully ask they be included in the record with unanimous consent as a part of today's proceedings. That is my presentation, Mr. Chairman. Members of the committee, thank you for your good work and certainly would appreciate your support on all these pieces of legislation.